So welcome back to the recordings of the content on digestive system. We have already reviewed much of the physiology as we went through these structures earlier on, but I do want to highlight a few general concepts regarding the physiology, and then we'll finish off by looking at pathologies as well. So there's really 5 processes in the digestive tract that we will look at closer. The first of these is ingestion, so voluntarily getting food into the mouth and then to the digestive system. This is something that I anticipate that will come up in your exam, so definitely the term word of knowing. The second process is known as our propulsion. This is the movement of the foods from one region of the digestive tract to another. And we already saw a few movements. We saw peristalsis, this wave-like movement of material along the muscular tube. And this was because the muscle fiber bands contract one after another, creating that net movement along that tube. We also saw segmentation, which was these non-coordinated contractions in a sense that there's no net movement. It's more of local mixing as we're squeezing, and of course the breaking down of the material on that part. So those were our important movements of the food from one region to another in terms of propulsion of the processes that we're looking. Let's next look, we've already saw the term digestion, so let's look at digestion a little bit more. This was breaking large food molecules into smaller. This can be both mechanical and chemical via enzymes, and this is needed so that they can be absorbed. So important term, digestion, for us to know. Breaking large food molecules into smaller. The second term that I want to really emphasize is going to be our absorption. This was when these smaller molecules are now small enough that they can be picked up by the blood vessels, or in case of larger fat molecules, by lymphatic system that carries them too close to the heart. So absorption, that was moving in from the digestive tube, digestive tract, into the actual body proper, to the bloodstream. And then we have finally defecation, eliminating non-digestible material. One good example of that would be the fiber. We saw we needed fiber as a bulk to move the material along the digestive tract and also give that sense of being full. So if you're dieting, getting sufficient fiber is important so you don't feel hungry. So really the defecation referred to that eliminating non-digestible food material from the digestive system. And this is going to take place in form of feces. So those were some of the important physiological terms that I wanted to highlight and make sure that we're comfortable with. And we will finish this video by looking at different kinds of pathologies. Some of these you'll get to learn in more detail as we do these digestive case scenarios in our labs. So let's start with peptic ulcers. Peptic ulcers are open sores in the lining of stomach or duodenum, and they cause this kind of burning stomach pain that comes and goes, lasting from anywhere from minutes to possibly even hours. And this can be caused by either bacteria, H. pylori, or taking more than recommended amount of anti-inflammatory medications like aspirin. So that's why those dosage instructions are so important for us. We would treat peptic ulcers according to the cause, but commonly it would involve decreasing the stomach acid production or the strength of stomach acid, so that can stop it from causing further damage where it's leaking out. And also, of course, if it is bacterial cause, then we would use antibiotics to treat. So that was our peptic ulcers. Let's have another example of pathologies. Let's talk about heartburn. Heartburn is what happens when the lower esophageal, so our cardioesophageal sphincter, fails, and as a result, some of the stomach acids climb up to the esophagus. This is, of course, not good as it will irritate the lining of the esophagus. And if this is repeated occurrence, this can then cause ulcers to happen, ulcers to develop at the esophagus. esophagus. If this is still repeated and we don't treat it, this can actually increase this exposure of ulcers to the stomach acids. It can increase the risk of these ulcers becoming cancerous. To treat heartburn, it really is neutralizing the acidity of the stomach acids as the first step until the patient gets better. We can, of course, do a lot of other things. We can avoid spicy foods. We can avoid eating late at night so that we don't lay down when there's a lot of material in the stomach so that doesn't get to the esophagus. Or we can even do the patient laying down in a slightly elevated angle to prevent that climbing up of the stomach acids to the esophagus. So a lot of things that we can do there. Obviously, if it's due to more severe things, we look at other treatment options as well. Next, I wanted to talk about hiatal hernia. Hernia in general is a term that refers to when an organ or tissue bulges through an opening that it should not be coming through. In this context, we see this as a stomach bulging through the diaphragm opening that is meant for the esophagus to pass through, and only esophagus to pass through. So we see that stomach kind of bulging through that hole. And this can have many different kinds of symptoms, or it can be done completely asymptomatic. And really the treatment of hiatal hernia depends on the severity. If it's not an issue, we just monitor it so that it doesn't get worse. We're aware of what's going on. If it is very severe, surgery may be needed to return the tissue or organ back to its place and then close the opening that it's trying to sneak through. So that was our hernias. Next, let's look at the condition known as pancreatitis. So as you remember from medical terminology, itis refers to inflammation. So pancreatitis is an inflammation of the pancreas. This is a serious condition that can either be sudden, so it can be acute, or it can be an ongoing issue, so chronic issue. It is most commonly due to one of the two reasons: excessive alcohol use or gallstones blocking the tubing that we have at this site. And really the treatment depends on the cause and severity, but often involves giving the pancreas time to recover by letting it rest. So that was that one. Let's have a look next. Hepatitis. Similarly, hepatitis would be a general term for liver inflammation. So again, we're seeing that term itis from medical terminology. This can be caused by many different reasons, including viruses. So hepatitis B or hepatitis C virus, for example. It can be caused by extensive alcohol use. It can be caused by certain chemicals, as well as some other disorders. And the symptoms can vary from really not having any symptoms at all to very severe. This could include, for example, yellowing, known as jaundice. It could include lack of appetite, vomiting, feeling tired, or, not surprisingly, abdominal pains, diarrhea, dark urine, dark reddish bowel movements, pain, and so on and so on. The treatment really would depend on the cause and severity. Let's have a look of another, but kind of a related condition, cirrhosis. Cirrhosis is a condition where there is a chronic liver damage that causes healthy liver tissue to be replaced by scar tissue. And there are many different causes for this. Most common probably would be hepatitis, which we just looked at, and also excessive alcohol consumption or abuse. There are many different treatments. They are what you would anticipate. Let's think of symptoms first. So the symptoms are like fatigue, loss of energy, weight loss, nausea, belly pain, fluid buildup in legs or abdomen, yellowing of the skin or eye whites, easy bruising, abnormal bleeding, confusion, drinking problems, or pale or clay-colored stools. And I was going to say about the treatment. So treatment, the reality is that it cannot be reversed. However, the progression of cirrhosis can be slowed down or stopped. If liver cirrhosis is left untreated, that can develop into a life-threatening liver failure. So really important for us to consider in that sense as well. Let's have a look of the next one. Gastroenteritis is an infection and or inflammation of the digestive tract. It can cause various different kinds of symptoms such as diarrhea, vomiting, abdominal pain or cramping, fever, lack of energy, and importantly, what we are concerned with would be dehydration. And this can be caused by many different things, such as viruses, bacteria, bacterial toxins, parasites, chemicals, or as reaction to certain medicines or foods. And this is usually not a great concern on healthy people who will typically improve over several days following this. Treatment for these people would really include rest, staying hydrated, over-the-counter medications to manage the pain, and vomiting. Really paying attention to the avoiding the dehydration is important here. Let's have a look of another condition, colitis. This is inflammation of the colon's lining, and there's different types. They might vary. Many types can be chronic, can be acute. Symptoms are largely as what we have seen before: abdominal pain, diarrhea, blood in a stool, fever, tiredness, constant need to have bowel movements, dehydration, and bloating. The cause of colitis is often unknown, but it can be caused, for example, by infection, autoimmunity condition, ischemia, drugs, radiation exposure, or immune deficiency disorders. Let's talk about polyps. Polyps are abnormal tissue growth and they can be found anywhere in the body. Here we look at them in digestive system and especially in large intestines. They are often harmless, but some can develop into cancerous and therefore we often just remove them when we see them during colonoscopy. Symptoms include blood in a stool, changes in the bowel habits, or tiredness that results from the blood loss due to the bleeding. There are many risk factors, including, for example, one's age, family history of polyps, a genetic component that plays role, one's diet, lifestyle, and if one has an inflammatory bowel disease as well. So that was our polyps. Let's talk about peritonitis. Peritonitis is an inflammation, remember itis for this, of peritoneum. And this was a structure that we talked about earlier on in our previous recording. This can be life-threatening. It is usually caused by a bacterial or fungal infection, and it can occur if bacteria enters into the gastrointestinal tract through a hole in the GI tract. This can happen, for example, as a result of burst appendix or a hole in the colon. And one must seek immediate medical care as it can worsen really quickly and have dramatic bad consequences. And this really nicely gives us a chance to talk about building on this and talk about condition known as appendicitis. This is an inflammation of the appendix, the small part hanging out from the cecum, the first part of the large intestines. Appendicitis is usually caused by a blockage in the appendix, which can be caused by a stool or tumors or other infections. If it is left untreated, the appendix can burst, which could lead into serious infection or even death in a patient. So that's why really appendicitis is treated with an appendectomy often, which is a surgical procedure to remove the appendix. After the surgery, patients usually recover quickly and are able to return to normal activities within, let's say, 2 to 4 weeks often. So that was our last pathology that I wanted to discuss. So we've really covered quite a bit of ground on these videos regarding the digestive system. As always, I hope that this has been helpful. I appreciate you being part of this class, and I look forward to either seeing you in in-person class or working with you in an online setting. Until next time, thank you and bye, and I'll see you in further contexts.